off, my name is Brittany Weiss. You probably get a lot of emails from me. I'm the Director of Admissions at Quincy University, and this is our very first Hawk's Eye View, specializing in nursing. So if you have other areas of interest, please know that we're doing more of these with other major specific topics every other Thursday for the remainder of the semester. Next up, I'll have Brianna introduce herself.
Hi, everybody. My name is Brianna Holbrook, and I'm an admissions counselor here. I work with a lot of students that are up around Chicago and I think Indiana, Michigan, Ohio, and some other states. But I actually just started this job, like late August, so I'm pretty new. This is my first kind of event to see a bunch of students at, really. So I'm excited to sit in with you guys tonight.
Awesome. Debbie Giesing.
Hi, I'm Debbie. I work at Blessing Raymond College of Nursing and Health Sciences. I am the admissions coordinator. I have been at the college for 18 years, and I work with all of the nursing students that come through Quincy University Partnership.
She's a definite awesome member of our team. Deb Race.
Hi, my name's Deb Race. I'm a junior and senior level faculty at Blessing Raymond. I've been there for 11 years. I've been a registered nurse for 33 years. I enjoy doing these things. I've done a lot of things at the SIM Center with the students. The courses that I teach are med-surg at the junior level and gerontology at the senior level.
So a wealth of knowledge. Abby Moore.
Hi, so I'm a junior nursing student at Blessing. I also work in the admissions department at QU, so I kind of work with all of these people. So I'll just be a great resource for you guys just to know kind of like from a student perspective, especially if you guys have literally any questions about anything, just like what a typical day is like or, you know, homework, tests, whatever, just feel free to ask and I can answer the best that I can. So yeah.
All right, thanks guys. So again, this is your expert panel. There's two ways that you can ask questions tonight. One, at the bottom of your screen, you'll see the chat feature. Simply send a chat to me and I can ask on your behalf. That makes it a little bit more anonymous. If you're not afraid, go ahead and just unmute yourself and ask away and we'd love to answer for you. So to start things off, I know it's always intimidating to be the first one. So what if I incentivize it and say, I will mail a prize of some sort to the first person who asks a question? Does that do anything? Who's gonna be the first one? And Noah. There, Allison Convoy, great job. Go ahead.
I have a question about the Blessing Raymond requirements. So I currently don't have a high enough ACT score, but I am planning to retake after my senior year. Would the highest score count towards my requirements? So if I got the actual requirement score, would that count?
So I keep saying there are some really good things happening because of COVID, and this might be one that we all have to kind of look for what that sweet spot is. But one of them is as we are waiving the ACT requirement.
Okay.
So for anyone coming fall of 21, spring of 22, we're waiving that requirement. So that will be something that you won't have to worry about. Are you coming in as a transfer?
No, I'm coming in as a freshman.
Awesome. So yeah, you don't need to meet that requirement. So congratulations.
Thank you. I was 1 point off, so I was like a little upset about that.
So what that tells us is you're probably, so they kind of use a benchmark of 22, but you know, if you had like a 16, that might be a different story, but since you're so close, I would say you're probably fine and you don't need to worry about retaking it if you don't want to.
Okay, thank you.
You're welcome.
That actually is a nice segue, Debbie, before I ask for any other questions, just to sort of go over the entire application process. How do they begin, and then how would they get accepted into Blessing Raymond?
Well, so you're going to start with Quincy University. You're going to go online and fill out an application with them, free of charge. And then on that application, there is going to be a place to put your major. So fill that in, and then number 9 asks you more questions about nursing. If you fill out number 3 and number 9, then once Quincy University accepts you, then they send all your information to me, and then I accept you into nursing. So you actually get an acceptance from Quincy University and then one from nursing. And then we're kind of doing it a little bit different now. So if you have below that 22, we kind of are doing a COVID acceptance letter just so we can kind of track where that is, but you're accepted and you're not pre-accepted, you're accepted in, and we accept you by your GPA. Okay?
Awesome, thank you. Any other questions?
We could even throw in a prize if there's some more questions. BRCN has been known to throw in prizes.
Second question, BRCN will send a prize.
Absolutely. I'll even let you choose, darn it.
All right, well,
somebody has to have a question.
We'll launch in with the most frequently asked question. Or
okay.
Allison, there you go again.
Sorry.
There we go.
Number 2.
So, how would I apply again to Blessing Riemann? You kind of cut out on me, like you kind of just went mute, and
well, that's not good.
No, I didn't hear half of what you said.
I'm so sorry. Can you hear me now?
Yes, I can.
Okay, so you're going to fill out that online application for Quincy University.
Okay.
And on that application, it's going to ask you what your major is.
Okay.
When you put nursing, that will trigger Brittany and the admissions crew to then, after they accept you, then I get a report that will come to me, and then I can accept you into nursing.
Okay.
Okay?
All right, thank you.
Awesome.
Absolutely.
Well, I'll keep prompting you guys to ask us any questions. And again, remember that chat feature, but we do have some most frequently asked questions that we receive a lot from nursing interested students. Why don't you give the next one, Brianna?
Okay, so a big one is about our simulation center. And this one I can have Debbie answer if she wants to kind of go into it a little bit more. Since I'm so new, I actually got to tour it a couple of weeks ago. And it's actually quite a state-of-the-art simulation center, especially for being a school so small. So can you just go ahead and describe it a little bit more, kind of go into detail of why it makes it so special to the school and how it compares to other schools, you know?
So Deb is an expert at the simulation center. She does such fun things, and with her being one of the faculty, she actually uses it and uses it quite well. She even becomes one of the patients in some of them, so she's very, very creative. So I'm going to let her take this one.
Yeah, take it off.
Okay. We do have, as I said, a state-of-the-art simulation center for a school of our size in a rural area. We got 3 grants from the state that made it over $1 million at the time when we got it. And at that time, a lot of schools had simulation equipment, but they were not using it. We, as a small school, again, embraced it, and all of our clinical courses have simulations built into their clinical. So some days you'll go to the hospital and do your clinical, and some days you'll go to the sim center and do your clinical. As a sophomore, they have actual classes there and a simulation so that you learn the basics: turning patients, transferring patients, bathing patients, some of the procedures such as inserting a Foley catheter, inserting NG tubes. All of that gets hit on them in that sophomore year, so you're going to be doing things right away and getting some hands-on experience right away. The thing about the simulation center is we can set those scenarios up however we want them. They can be as simple as we want them, or they can be as complicated as we want them as you move through the program. Of course, we want them relatively simple at the beginning because you don't know as much and you can't apply as much. But by the time you get to senior level, you're doing some things like you would be doing in the emergency room or in ICU. Well, you're actually progressing through that program with your skill sets as well. We do have mannequins. We have child mannequins. We have adult mannequins. We have a pregnant mother who gives birth. So when you're in maternity, you're going to do some simulations where that mannequin will actually give birth, but there will be complications. We don't want these simulations to be just a ho-hum kind of day. Oh, nothing much is going on here. We're just kind of talking to this simulator. No, we want to challenge you and have that simulator do something, a change in condition that's going to have to make you think, what do I need to do? What if I don't do well? What if this simulator dies? And they could. You know, it's very possible. However, this is a place where that would be okay to happen because we can turn them off and turn them back on. We want you to be prepared when you go to the hospital and are actually taking care of real patients. We can't turn them off and turn them back on. If they die, they die. And so this is a place where we want you to make mistakes. This is a place where if those things don't go well, we can stop, we can actually pause and have a conversation and say, all right, you're stuck here. Think about what's the next thing that you might need to do. So we have a lot of things that we can do. The simulators talk. They have pre-programmed phrases and words that they can say. Plus the staff can also, they have a microphone and they can actually talk for the mannequin so they can call you by name. One of the funniest things that I ever had, I had a student that was actually chewing gum. And I could see on the screen as I was watching the student, and he was just chewing that gum because he was nervous, of course. And so I, speaking for the mannequin, said, oh, would you have an extra piece of gum for me? Well, he ducked out of the screen, and the next thing you know, he didn't have the gum anymore. And I asked him later, you know, what did you do? He said, I just swallowed it. So he got so nervous, of course, with me asking him about the gum because he knew he wasn't supposed to have it, that he just swallowed it. So we can see you, we can hear you, we can video record you so that you can watch yourself later. Because often we have mannerisms that we don't realize that we have. I talk a lot with my hands. You haven't seen them because they've been down low, but I talk a lot with my hands. We don't realize that we're doing those things until we see what we're doing. And then we can critique ourselves. We can critique the performance, a lot of things that we can do over there. So you spend a good amount of time, but you learn a lot. Well, anybody have any questions about it? That's kind of a quick overview. It's fun. I usually play an old confused lady that they can't keep track of. I wander around, I get outside, and they don't know what to do with me.
That's amazing. What about tuition? Being two separate schools, Debbie Giesing, now throw this one to you. How does it technically work if I'm attending both schools with tuition?
Okay, so your freshman and sophomore year, your freshman year, you're really taking all your classes at Quincy University. So your freshman and sophomore year, you're going to pay your tuition to Quincy University. Your junior and senior year, you're going to be taking a lot more nursing classes than gen eds and classes at Quincy University. So you're going to be paying your tuition to Blessing Riemann. So it all is kind of an internal thing. You really don't care where you're taking classes. You just have to know that your freshman and sophomore year, you pay your tuition to Quincy University. Your junior and senior, you pay it to Blessing Riemann.
And you graduate from both schools.
Yeah, so your diploma is actually a joint partnership and what do I want to say? Degree. Thank you. From both schools. And what's really kind of fun is, remember I said that we accept you 2 times from Blessing Riemann and from Quincy University. Well, guess what? You actually get 2 graduations too. Mm-hmm. So you actually get the traditional graduation from Quincy University, and then you actually get a little bit more solemn pinning ceremony at Blessing Riemann. So, and then that degree, your diploma, is going to say Blessing Riemann and Quincy University.
Awesome. How about a student perspective, Abby? What would you say a typical day is like if you have a bunch of nursing classes?
So like Debbie was saying, freshman year, it's pretty basic. You're just going to be taking a lot of gen ed. So it's going to be a pretty typical like freshman schedule. But then sophomore year, you start getting into those nursing classes. You kind of ease into it like first semester. So you start your clinicals, but you're only at the hospital every other week and you're not prepping yet. You're just kind of getting used to everything. You do a lot of simulations like Deb was saying. So it kind of gets you comfortable. You do your checkoffs and stuff. And then for me as a junior, things kind of get a little more, I don't want to say like hectic, but obviously you have more to do junior year just because I have 2 clinicals a week now. So I spend more time at the hospital, but that has helped me a lot, especially just getting experience and just I've learned so much, and it's only October right now. So it really does help a lot. I have only done 1 simulation this semester just because, like I said, sophomore year, you're kind of like getting all of those skills, and then junior year, you're really putting them into practice and they expect you to, use everything that you've learned. But of course, the instructors are very helpful and making sure that they're with you if you don't know something, or if you're just a little confused, whatever. They're really good at answering questions and helping you feel comfortable in that clinical setting, and then kind of just easing you into that. And then the more that you do it, the more experience that you get. So it really helps with that too. So I'll just give an example. So today I had clinical from 7 to 1. It was my pediatric clinical, so I spent the first 5 hours doing that, and then we have post-clinical after, so we reflect on our days and explain each of our patients so that we each kind of get a learning experience even if we weren't working on that patient directly. And then I had class after that, and then that's basically your day. And then I try to schedule different parts of my day all the time just for studying, because I have a test that I have to take this weekend, because a lot of our tests are online now just because of COVID and everything. But so usually you'll have clinical in the morning on one of the days, and then throughout the week, you have classes. And then, like I said, I try to use my resources a lot, spend a lot of time studying, and then it really makes it manageable as long as you have really good time management and use your resources. So
What does prepping for a clinical look like? What does that include, I guess?
So prepping for clinical, your instructor will give you the room number of your patient the night before, depending on what floor you're on. And then you really just go into their chart, and then you usually have a worksheet that they give you. And then you also have a medication worksheet so that you know what meds you're giving and how to give them. And then you're just going through their chart, learning more about their condition, making sure that, what kind of care you're going to be giving them, what the priorities are going to be when you're taking care of them. So it can be, pain or infection, depending on what they have, things like that, just so you know what you're going into and how you're taking care of them. And then, time, it just kind of depends on your patient. Usually it takes about, I would say, 1.5 to 2 hours, just depending on, again, how lengthy your condition is or what kind of patient you have, if you're familiar with it, if you're not. But you're really just kind of familiarizing yourself with that patient, so you're not going in blind, and that you have a good idea of what you're going to be doing and how you're going to be doing it. So it actually really does kind of take a lot of the stress off of clinical, because you know what to be expecting.
Great, thanks. Oh, you're muted, Debbie.
Okay, there we go. Got it? Okay, so I'm going to take a step backwards and talk about freshman year and some of those requirements, especially for you transfers. So your freshman year, you're kind of saying, well, shoot, I thought I was going to be in nursing, and I'm at QU the whole year. You're telling me I'm not taking any nursing classes. We cannot stress enough, whether it's Deb, whether it's Abby, or me telling you, anatomy and physiology are going to be the most important classes you're going to take. So really, 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 if you're a transfer and you're taking them now, make sure you understand all those concepts, because guess what? When you get to Deb in your junior and senior year, she's going to assume you have all of that information and that you know it very well. So every class that you take in nursing is going to build on that foundation that you have from anatomy and physiology. So they're not going to question, oh, do they know about the arm? Do they know this? They're going to say, okay, they know that from anatomy and physiology. So now we're going to talk about how do we apply that knowledge to these patients. So just keep in mind that those are going to be really important classes. That freshman year, there's 5 prerequisites that you're going to take to be able to start nursing in that sophomore year. So if you're a freshman, this is what you're going to do in your freshman year. If you're a transfer, you're going to have these done to be able to start that sophomore year. So it's English Comp 1, Anatomy and Physiology 1 and 2, Intro to Psychology, and then if you're at a community college, you're going to take developmental, or you're going to take lifespan psychology. If you're going to be a freshman at QU, you're going to take child psychology. Those classes have to be done and you have to have a 2.7 support course GPA and cumulative GPA to be able to start those nursing classes in your sophomore year. Your cumulative is obviously all the classes you're going to take. Your support course is a little bit more defined because it's a smaller group of classes. So for going in, it's going to be those anatomy classes, it's going to be those psychology classes, and then as you enter the program, you're going to start adding micro, you're going to add statistics. Those two classes do not, I'm going to say it again, do not have to be completed before you start nursing. They are part of your nursing degree plan. So some people get really confused and think they have to take them ahead of time. They do not. Statistics actually isn't on your degree plan until your junior year. So I really kind of want to stress that, and that support course GPA is a smaller group of classes. So to get that 2.7 is really, really critical to getting into nursing. Okay?
We did get a question on the chat, Debbie.
Okay.
If I took medical terminology and CNA in high school, where do I stand classes-wise?
Okay, I don't know, Deb, if you want to talk about that, I certainly can. Do you want to talk about it, or do you want me to? Deb? I don't think she hears me. Okay, so there you go.
What do you want?
So CNA.
Oh, well, the CNA is always a good thing to have as a part of your background. You're less nervous about going in and taking care of patients. You've seen some things that make you feel a little more experienced. You're allowed to do some procedures as a CNA. So having that is a good thing. I don't know where that, I know that after they do something at the freshman level, can they not sit for that exam as well, Debbie?
So it doesn't, none of the, yeah, so none of the credits from it transfer, just the knowledge transfers, but it does seem to make our students much more comfortable in that sophomore year with patients, because that's kind of one of the biggest things, is to learn how to deal with patients and the private things that you encounter with your patients. And so as a CNA, you've got to experience that. Currently, if you don't want to get it ahead of time, after that first semester of your sophomore year, after you take 206, you can contact our registrar's office, and they actually have the paperwork to do to help you to sign up for it and turn that in for your testing for it. So if you don't have it by the time you get to your sophomore year, it's fine. Some people like it, some people don't have it. Either way is fine. Just know that the credits don't transfer, but you can sit for it after your first semester of your sophomore year. Medical terminology, Deb, was the other one. That actually can be used. That's a great class to have. It helps you with the knowledge of it, but I'm going to let Deb take that one.
It is a good class to have. I don't think we require it right now.
We don't. It goes to Gen Ed. Mm-hmm.
Yeah. We go back and forth. It was required, and then it wasn't, then it was, and it wasn't. We kind of go back and forth with that. It's a good thing to have, because the medical field in and of itself has its own language, and nursing has its own language. And so as you start getting into some of the med-surg classes, as you start to get into some of the other classes that you're going to have, words are going to come up that you're like, I don't have a clue what that means, but it's med term that's related to the nursing profession. So having that little bit of background, if you need just an elective class or something, that would be a good one to take.
Right.
Because I think it'll give you a step up as far as that language and being able to talk the language. When you get report on your patient from the floor, those nurses are going to be talking pretty fast, and you may not quite catch and understand exactly what they're saying because you don't quite know the words and the language. So I would highly recommend it. I think it's a good idea to have if you can fit that in somewhere as an elective.
So we have several gen eds that you can take. So some people will take all kinds of different things for gen eds. That is probably one of the better ones to take. We always say, especially if you're going to transfer in, or if you're going to dual enroll, please get a hold of us in the admissions department. we can kind of steer you towards the ones that are actually going to apply and be more beneficial towards your degree. Not that the other ones can't be used as common gen eds, but if you can take one that's going to take a class actually off of your degree plan, why not? Also, some of the gen eds, we have nursing electives. So sometimes maybe a nursing elective might be a lot more beneficial and maybe even more interesting to you than a common gen ed. So we always say before you start signing up for those dual enrollment, before you start signing up for those gen ed classes, really talk to us. And so like some of them, they have as forensics, they might have diabetes, wound care, they have the art of nursing, they have stress management. So some of those might be more interesting and more applicable to your profession than maybe a regular gen ed. I hope that helps.
Great. We have another question, Debbie.
Okay.
It says, as a transfer sophomore, given that I have all of my gen ed classes done and some nursing electives, do I have to be enrolled full-time at both QU and Blessing Riemann?
So what I would really suggest is letting us look at what you have, and then especially the registrars can really help you with, if you don't want to be full-time, you certainly can take it slower. It always affects your financial aid. So that's kind of what you want to look at. And for some financial aid, for some grants, for some scholarships, you have to be full-time. That's 12 hours or more. So that would be a great question to talk to us about or email me about afterwards, so we can really make sure we give you the right information for your particular situation.
Debbie, in the chat, do you see the chat function at the bottom?
Mm-hmm.
Would you mind just plugging in your email address, and that way it'll go to everyone and they'll have it to send you
Absolutely.
questions. Thank
Yep,
you.
I can do that. Mm-hmm.
And I have a question for you, or really just to prompt you, I guess, because I hear you say all the time, if you are a transfer student and you go specifically to John Wood, I hear that, do 1 year if you can, and then come over to us. Why is that so important?
Right. So no matter how many gen ed classes you take, you're still going to come into us as a transfer sophomore because of those classes that Deb was talking about for nursing. So let's say you take 2 years at John Wood and you have your 64 hours and you're ready to come in as a junior. That would be really wrong of us to say, oh yeah, you know what, you've got enough hours, just come on in and we'll put you in as a junior, because you couldn't be successful without having those sophomore nursing classes and all the clinicals that you're going to need. So shame on us if we said, you know what, yeah, that sounds like a great idea, come in. So that's why it's so important that first year at a community college to make sure we get you in those right classes, so that at the end of that year, you're going to come into us as a sophomore and still have a 4-year degree plan. If you take those 2 years at the community college, when you come into us, it's going to be a 5-year plan because you're still going to come into us as a sophomore.
Great. Thank you.
Mm-hmm.
All right. Continue to use that chat function, guys. I think that might be even the easiest thing, and I can ask on your behalf. While we wait for some of those to come in, Brianna, do you have another question that we get a lot?
Yes, I did think of one. I know we have some new programs, or well, Blessing Riemann has some new programs, respiratory care and radiology. And so I've been getting a lot of questions about what those two programs entail and if they're minors or majors. So that was going to be my next question.
So starting fall, we are going to offer those both as bachelor degrees. They haven't been in the past. They've both been associate. So, and we are joining with our partners, Quincy University. So, so these guys will be recruiting with us now for that. It's going to be very, very similar to nursing. So it's going to be a 4-year Bachelor of Science. You're going to do that freshman year at the partner school. The prerequisites are the same. The GPAs are going to be the same, and the same thing is happening is we are waiving that ACT for those also. So it's going to be very, very similar to that. The big difference, I think, is, well, obviously just the nature of the work, but The radiology is going to have a cap of 11, and respiratory has a cap also, where nursing so far, I mean, we do have caps, but so far we've never reached them, but they are much larger numbers. And that is kind of due to the size of the classrooms that they have, because the classroom for radiology is not held at Blessing at this point in time, at Blessing Riemann. So they do have a cap of that, and the spots that they have for clinicals is more limited too.
We look like we have a chat. It says, if I graduate high school with dual credit from classes like statistics and English Comp 1, will those transfer?
Absolutely. So, and that's why I say, you know, when you take statistics and stuff like that, some people look at our degree plan and say, oh, you know what, I didn't do well, but I really didn't need that to my junior year, so it won't be a big deal. What happens is once you take those classes, they are on that transcript. And so any of those gen ed classes, I've not really seen any, especially from our local community colleges, that don't transfer. So what's going to happen is that freshman year, if you're coming in as a freshman and you have that English Comp 1, now instead of having a 16-hour semester, you're going to have a 13-hour semester. So that's just going to come right off those hours. For statistics, that's the second year of your junior year. Guess what? Now you're going to have 13 hours instead of 16, when, like Abby was talking, now you're going to have 2 classes. They're going to have clinicals. It's going to be much more nursing intensive. So you're going to cut those hours down and have more time to spend on those nursing classes and nursing clinicals.
Awesome. We're getting the best questions now, Debbie. So
awesome. I love it. I love it.
Next one is, when should we start preparing on our own time for the Nclex? Am I saying that right?
Yep.
Okay. Do you recommend any good studying material for that?
Oh, Deb's going to take this one. She's the pro. She actually does a whole PowerPoint on how to study for nursing, and she's going to talk about the mentors and all of that stuff. So,
the nursing major is much different than any of the other majors. It requires a lot of motivation, a lot of self-discipline, a lot of time management. You're not going to have the extra time that some of the other majors do, because by the time you get to junior level, you have 2 clinical courses. So you meet twice a week for class, and you meet twice a week for clinical. So there's 4 out of 5 days of something going on. I would recommend, you're going to have so much time to study for Nclex. I don't see how you can possibly start studying for it until you start taking the nursing classes, because you're not going to have the background and the knowledge to answer those questions. I would recommend taking the time now to do well in those classes, like Debbie said, like A&P. It is so vital that you know normal anatomy, so that when you come to the courses and we start talking about disease processes, that you can recognize abnormal, and then we're going to teach you what to do about it. So as far as Nclex, there are lots of programs out there. We use Kaplan, and we use a Saunders book. There are prioritization and delegation textbooks that we use. So we have a lot of resources that we use, and you're assigned a certain number of Nclex questions per course. By the time you get to senior level, you're doing about 100 questions a week, with an expectation of meeting a certain level of those. So you build on the knowledge as you take the courses. So I wouldn't really get too worried about taking Nclex practice questions now, because you're not going to understand the rationale for them yet. So I would hold off on that and put your time into doing well in your courses, because that's going to help you as you start into the nursing classes.
Great. We got another question, and you might have to help me on this one, Debbie. It says, where do I send my personal statement for the application? Do they have to send in a separate one than our application, than the QU app?
We don't require a personal statement. So you don't have to send one to us. As long as you fill out that application, that QU application, and fill in the nursing major and the other, number 9, that's has to do with nursing, that's all we need.
Mm-hmm. And if you do the personal statement that's on our application and send that in, you're good to go. If in fact you're actually meaning the test optional essay or template or graded paper, that can actually either go to admissions@quincy.edu or directly to your admissions counselor. So for instance, I know some of you being local might be working with Paige. You can send that directly to her. And if you have a follow-up on that, if I didn't answer it appropriately, let me know. All right, how about another one for you, Abby? What do you wish you knew when you were a freshman, when you were starting out?
So the biggest thing that I'm especially learning this year is that you're never going to know everything that you're presented with. I mean, I've spent so much time this year like studying for tests and like trying to go over every single thing, and it's like half the things that I study are on the test. So I would really recommend just making sure that you're taking like really good notes in class and keeping track of those key things that your teachers emphasize, because most likely those are the most important things that you need to know, and those are the things that are going to be on the test. Whereas, you know, like you're not going to have to know like every little, you know, mechanism of every muscle in the body, you know, whatever. Just really taking those notes. And I mean, now with COVID and everything, every single class is recorded, you know, because of the people who are virtual and stuff. So that's actually been a big benefit for me this year, is that part of my studying, I'll go back and listen to some of my lectures that maybe I didn't understand a part or whatever. And then again, I'll like really highlight those big things that I hear my teacher like, you know, repeat over and over again, because like I said, you're never going to know anything, and you're just going to be stressed out and frustrated and disappointed all the time if you're trying to, you know, memorize every little thing, because in nursing school, you cannot memorize things. Like, you have to know what you're learning and why you're learning it so that you can apply it, because a lot of your tests are application type questions. They're not just straight, you know, textbook answers. They're, you know, this is what the patient has, what is the nurse's first priority. So you have to know what you're learning and why you're learning it. So yeah, the biggest thing is that you're never going to know everything, and understand that, and just make sure that you know the key points and then know how to apply those to certain situations. And then a big thing also is using your resources. I know that everybody says this all the time, and I do use my resources, but honestly, I could be using them more. The teachers at Blessing are really, really good about making time to set up meetings with you guys. Go over all of your tests, even if you do good on them, if you do bad. Again, you really want to know that information, because it's not just going to go away, and it's going to keep building off of each other. So that is my biggest tip.
Awesome. That is helpful. What would you say, Debbie, is the average class size for nursing specific courses?
Deb, wouldn't you say, I know I've heard it more from her, usually what, 30?
Oh, it's about 30. We try not to have too big a classroom, because we're a small school and we like to interact with our students and get to know our students. And if you have large classrooms, you can't do that. I've had as large as about 45, and that is almost overwhelming. And so at that point is when I broke my med-surg into 2 sections, so that I would have half and half in the 2 sections, much easier to handle. You can do a lot of different things in class besides just stand there and talk to them if you've got a smaller class. So about 30 is where we try to keep it. Some classes are much smaller than that. Some of the elective ones are smaller than that, and they try to keep them small deliberately. But about 30 is what I would say is probably right. And I wanted to also say something about the tutors. We have 2 nurse educators on staff who are MSN prepared nurses, and one working on his doctorate right at the moment. And they are available to help with registration. They're available to help with advice on where you're going with the program. And they're also available to meet with independently, to review for tests, to help with paper writing, because we do write lots of papers as nurses. We still have to write papers. They can help with that. They can help identify some areas where you might be weaker in and give you some extra work to look at to help with that. We also have peer tutors, which are students who have been through the individual classes and they have volunteered or stepped forward to offer services to the underclassmen. And so they can also help with writing papers. They usually hold sessions where they do test reviews prior to the test, the actual test for the courses. And with COVID, we've been recording those, so that also is a benefit for those who can't come to the review session, that they have access to that. So we do offer a lot of those things. Those things are free. You know, some universities charge for tutoring services. We do not. That is free to anyone that wants to use it. And we highly encourage students to make appointments with those nurse educators, whether you think you need them or not. Don't wait. If you think that you're struggling, then you probably are. And good thing to get hooked up with them early on rather than by the time you get in such a hole, then they really can't help you.
Thank you for mentioning that, Deb. I'll also echo just in that even in your upper level Quincy University specific courses, we also offer free tutoring in our Student Success Center underneath the library. So between both of us, you guys are going to have a lot of support, which I think is great. We did get another question. This is my favorite question so far because I am very interested in this too. What items do you recommend to have when starting nursing school? For example, I've seen clipboards with cheat sheets for when you're in clinicals. Are little gadgets like that helpful, or do you recommend anything else?
I'll start first. So when you are ready to become a sophomore, we have a whole list of requirements that you need to meet, and it also offers the items that you need to purchase. So as soon as for you transfers, usually as soon as I can see that you're going to be coming, I will go ahead the semester before and send you that. For freshmen, once we do progression at the end of your freshman year, I'll send it to you. But we have a whole several pages of stuff. So it tells you all the immunizations you would need. It tells you like scrubs, your stethoscope, and all of that stuff. For the other question, I'll let Deb answer whether I don't know whether something like that is useful or not.
It depends on how you study and how you remember things as to whether those things would be beneficial. You're going to be, when you're doing your care plan for your patient, you're going to be looking up meds. So you're going to have that written down somewhere, that information about the meds. We give students often sheets to help them with common meds, common labs. I do a lecture that I've started doing in the last year about relevant lab values because students don't really know what to do with them. We talk about labs in class, but we really didn't go into any detail, and labs are very important. And so when you think about all the lab tests that a physician might order, screens and screens and screens as you look at that, we need to break that down because we need to look at the relevant ones that are relevant to that patient right now. And if we didn't do something about it, what's the worst outcome for the patient? The worst outcome for the patient is that they will die. So if having a clipboard with those sheets that we give you in class or clinical with you in clinical, certainly that's fine. Clinical faculty will tell you what you're going to need to bring to clinical, what kind of plan of care, what kind of sheets. They're going to be able to give you more information on that, and they are more than willing to help you out with that and make sure that everybody's on board with the same tools. The access to the internet is something that we didn't have back in the dark ages when I went to school, but you have, when you're on the floor doing clinical, you have access to the internet if you need to look something up. So you have resources at your fingertips. And you also have to remember that you're not in this alone. We are interprofessional as we're caring for patients, which makes for better outcomes for them. So you have peeps that can help you in other disciplines, and we often call on them to help us as we care for our patients. So you have a lot of resources. So yeah, if a tool like that works with a clipboard that you want to carry around with you, again, you have to be real careful now with COVID of carrying stuff like that around, and where are you going to lay it? Where are you going to put it? so that you don't contaminate it and then take it somewhere else. So clinical is not how it used to be. It's different, and we have to think of it differently as we look at some of those paper things that we give you. Is it better to have it online? We're always changing. Always changing.
Brianna, how about another question you get asked frequently?
Yes, so I've gotten a question a lot regarding advising. So when you get accepted into Quincy University and Blessing Riemann, who would your advisor be? Would it come from QU or Blessing or both?
So your freshman year, you're going to have a QU advisor depending on what letter of the alphabet your last name starts with. Then when you start your sophomore year in nursing, you're going to keep that advisor from QU, and they're still going to be there to help you. But now you're going to add one of those two nursing advisors that Deb was talking about. And so for advising for QU, Kim Erskine has been assigned to the QU students, and she is an awesome resource for you guys. So not only is she going to be your advisor, but you can also use her to tutor. And then Christian, you can use him to tutor also. So that is the best. And I'm with Deb, and I'm sure Abby will jump in too. The best thing we can say is use your resources, whether it be those peer mentor tutors, whether it be Deb as your professor, whether it be Kim or Christian, whether it be a really good study group. Get a really good study group together. You can bring lots of different pieces of the puzzle together. Sometimes your best friend is not your best study partner. So I've had people tell me they've had 3 or 4 study groups before they found the right fit. So don't be afraid to keep looking for that right fit for you.
Awesome. How about this question? I get this asked a lot. Do you offer a loan payback program if I work at Blessing after I graduate?
Oh, everybody's going to love this news. So yes, we do. And it is awesome. So after your sophomore year, we told you your financial aid is going to start through Blessing Riemann. So you're going to go, our financial aid coordinator is Erin McCarg, and she'll contact you. But when you talk to her, you might talk about, I don't know if any of you guys have heard of BERF. It's the Blessing Educational Revolving Fund. I see some heads nodding. Wonderful opportunity for anyone that is going through Blessing Riemann that is planning on staying in the Blessing system. So when you apply for that financial aid in your junior year, you would tell Erin you're interested in this BERF. After you graduate, pass boards, and get hired by Blessing, you work off 100% of your junior and senior year. And you're going to say, wow, that sounds too good to be true. This is one of the few things in life I can say actually isn't. So it is what it says it is. You work it off at $100 a week or $5,200 a year. One of the most impressive pieces is it does not affect your pay. So your pay stays the same, and this is actually a different pot of money that you can use. The federal government currently has found out that there is a nursing shortage. So now, after 6 months of employment at Blessing Hospital, you can actually get $10,000 towards your federal loans, which you may incur your freshman and sophomore year. That can be renewed 3 times. There's different rules that go along with it. We can always send you the brochures on it. But let's say after you graduate, you've signed up for BERF, and 6 months down the road, you decide that you want to go work at Children's Hospital in St. Louis. What happens is you haven't accrued any interest while you're in school. 6 months after you graduate, interest starts accruing, and it currently is at 3%, which is an awesome rate and is comparable to the federal rate right now. So it would just go into a simple interest loan as if you had never taken it in the beginning.
Awesome. We got a question regarding this. Is Hannibal Clinic part of the program? So could I work at Hannibal Clinic and that program work for me?
No, you have to work at Blessing Hospital, and it has to be, it can't be even in our clinic. It has to be a bedside. It has to be those particular jobs that you are trained for in our program that are more bedside nursing, and those areas that the clinics are usually easier to fill. And that's not really considered bedside nursing. And so it's usually those bedside nursing positions.
Okay. What about COVID? I know that is a big thing right now. Everyone's pivoting a lot of times to virtual learning, things like that. Can you explain the COVID safety practices that Blessing is doing right now?
We sure can. I will talk about the school, and then Deb can talk about anything at the health system that I don't know about and I'm not part of. But for our nursing students, when you come into our front doors, we have the kiosk to take your temperature. So it has to be a normal temperature. We have a book that you have to record it in. We have a sticker that you wear that says you've been screened that day. Also, part of our criteria now is you have to wear a mask at all times, but you have to either wear goggles or a face shield anytime. Really, students have to wear them pretty much anytime, except for if you're eating, and then you have to be 6 foot away. Why that is so important is if someone does contract COVID, we are at the lowest risk level with being totally protected like that. So we are doing everything we can to keep our students in class and most importantly in clinical. So Deb, is there anything you can add to that as far as when you guys go in the hospital?
Well, in the hospital, they would follow whatever policies and procedures they have in place. And that's sometimes a moving target because it sometimes changes a couple times. Early on, it changed 2 or 3 times a day. It's pretty much settled into a routine now, but I do not believe that our students are going to the floor where the COVID patients are. I'm pretty sure that's correct. You would have to wear whatever protective equipment they have deemed necessary at the hospital. It just is a matter of what is available. And they've opened up the new floors now in the Mormon Pavilion, so there's a lot of moving patients around, a lot of different units that you might be on other than just with the COVID patients. As far as classroom affected by COVID, in the spring, we went all virtual. When we came back in the fall, we are doing face-to-face courses. We have limited number of students in the classroom where the tables have been moved out so that they're close to 6 feet apart. Students have to wear a mask and goggles in the classroom. We're recording. We use Blackboard, so we're using Collaborate to record lectures, as Abby said earlier, for them to listen to at another time. Most of us use PowerPoints, and we also have podcasts that students can use at any time. It's difficult to do any kind of group work right now because you can't get closer than 6 feet. So that's sort of curtails how we approach some of our teaching methods. But I feel very blessed that we have maintained face-to-face to this point. With Adams County numbers going up, I feel very blessed that we have been able to do this. The students shared at the beginning of the class that they didn't like the online, the virtual, because what are they looking at? A blank screen. You can't get everybody's face up on Collaborate. Can't even get my face up there. If I'm talking and I have my PowerPoint up there, they can't even see me. So I'm talking to a blank screen and they're hearing this voice coming at them from the computers. That can put you to sleep pretty fast. So they want to do the face-to-face, and they've been very good about following the guidelines that we have for them. Sometimes they forget, sometimes I forget. I was walking down the hall the other day and it's like, oh my God, where's my mask? So I had to run back to my class or to my office before somebody caught me. But we forget. We're not hardwired to it yet. We think about it. It's the beginning of every news report that you hear. So it's out there, but we're not hardwired with it yet. And I hope, you almost hope that you never get that way. We hope it's over. I want it to be over. I want to go back to touching. I want to touch my students. I can't give them a hug when they're crying. And they do cry. Yeah, they cry. But I can't give them a hug to console them. When I lecture, I'm wandering around the classroom and I'm touching them on the shoulder, or I'm pretending I'm listening to their lungs, and I can't do that now. So that's been very difficult. But I told them, I said, when this COVID is over, look out, because if you see me in the hall, I'm liable to grab you and hug you without you even knowing. So we follow whatever they tell us to do.
I'll say at Quincy University as well, we're doing the masking that is required. We're lucky that we have, if you're in Quincy, you know North Campus, which used to be the seminary. It's about a mile away from our main campus, but we have a lot of big auditorium spaces and things there. So we've been able to utilize those rooms to distance. Only 20% of our courses are online. So we're also very grateful that we are still in session. We do surveillance testing on our students, normally for NCAA compliance within athletics, but sometimes non-athletes are also chosen if they're willing. And we do that every week, a little over 100 students. And so that's helped us to see those asymptomatic cases and then quarantine those students, which we have a ton of rooms available at our North Campus facility, which is also the retreat center in town. So again, we're very lucky with that, but we're definitely trying to be as safe as possible, but also keep our students on campus. So we have about 5 minutes left. If there's any last questions, again, please chat me. One thing I'll ask, because I always love to hear you talk about this, Debbie, but I know that you guys have at Blessing the caring cupboard, or I can't remember the name of it now, but what does that look like for students? I love that you offer that.
Yeah, so it is called the Caring Cupboard. And so we recognize that a lot of college students don't have a lot of money and there's a lot of needs out there. So we have a whole area designated with all kinds of food, hygiene products, diapers for our mamas, all kinds of things. And literally you just go up and take it. There's no questions, there's no anything. We have our social worker, our counselor that kind of monitors what needs to be replaced. We have some very generous people that give to that. And what we do a lot is we have a really, really nice student lounge. So we usually have peanut butter and jelly sandwiches every day for lunch that you're welcome to take. Now we've had to be more careful too. I don't know exactly. I don't think that's going on. I think they have more packaged things, but I noticed that somebody's been putting things, cartons of milk. We've had all kinds of things in the refrigerator. A lot of times there's now prepackaged things sitting on the counter. We have scrubs. I noticed we had some shoes. They have books, all kinds of things for students. No questions asked, no question of need. You just go take what you need and it's available to you.
Great, thank you. All right, any last questions before I wrap up?
I have a question.
Yeah.
If you are a freshman, do you have to live on campus? Because some colleges require that.
We do not require it at Quincy University if you are within this 40 to 60 mile radius.
Okay.
And if so, I think you're from Hannibal, is that right?
Yeah.
Awesome. So you would be good to go if you want to live at home, but just know there are options for you at Quincy too if you would like to live on campus. I'm actually from the Quincy area and I'm a QU alum as well. My first year as a freshman, I lived at home, but I got so involved on campus. I ended up being a student tour guide like Abby, and I was in a ton of different clubs. And a lot of those clubs, because you're in college, happen at 9 o'clock at night. And so I decided to move on to campus my sophomore year and then continued all the way through senior year. So if you want to run the numbers, even work with Paige, your admissions counselor, and we can run you a financial aid package that shows you as a commuter and as a resident. And there's some extra grants you might qualify for that'll allow you to live on campus and it still be affordable. So just check that out with us.
And remember, there's a lot of help for you for your junior and senior years. So you can work that off completely. So maybe it might be worth it for you to live on campus and get that experience. I also wanted to mention really quickly, Quincy University has a nursing learning community. So you can live on campus and live, they try to put all the nursing students on one floor. So again, if it's gross out and you don't want to get out or you have a question late at night, you can run down the hall, ask your buddy. There's a big study room at the end of the hall. You guys can stay there. We just did a simulation event to kind of tie that freshman year into what nursing simulation is going to be like. We just had some faculty come, have kind of a question and answer session with our freshmen. We're going to actually have some upperclassmen come in the spring, talk to you guys. So there's a lot of advantages too to being on campus. So kind of keep that in mind too.
Thank you. Anything else in our last minute? All right. Well, thank you guys so much for joining us. You have the admissions@quincy.edu email, and Debbie put her personal email in the chat as well. So if you have any questions specifically about transferring or the degree checklist or anything like that, make sure to let us know. Again, I am recording this session, so if you'd like a refresher or you want to send it to mom or dad or a friend, just tell me and I can email that to you as well. But again, thanks for joining us, and we hope to see you guys on our campuses soon. We also have virtual visits if you want to do something individual.
Thank you. We'll be waiting for you at BRCN.
Bye. Thanks, guys.
Bye.
Good night.